Good morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. In this episode, we are going to discuss about another common problem, very prevalent in obese, which is called systemic hypertension or elevated blood pressure. Now, what is hypertension? Hypertension is a it's a persistent recording of elevated blood pressure with respect to the age, sex, and build of the individual, because it will vary with age, sex, and build. So you should not look into one value alone and decide that he is hypertensive. As I said, it is a persistent recording of elevated blood pressure over a period of time, and you should also consider the age of the person, sex of the person, and build of the person before concluding that he is a hypertensive. Now, before going on to the actual problem, I just want to tell a few words about the basics of blood pressure. Now, we should know what is blood pressure. Blood pressure is nothing but a lateral pressure exerted by blood column along the walls of the blood vessel. The blood vessel has got blood, and the blood is streaming, it is flowing, and while flowing, the flow is usually smooth, and while flowing, it exerts a pressure along the walls, a lateral pressure. And this we record it over by tying a cuff, connecting it to a mercury manometer, which is called sphygmomanometer, and the pressure exerted by the blood column is transmitted and recorded by the elevated mercury column, which we note it down. So, two pressures we usually note. One is systolic pressure, other is a diastolic pressure. Now, what is this systolic pressure? Systolic pressure is the maximal recordable pressure during a cardiac cycle. Cardiac cycle means a heart will beat once in 0.8 seconds and will undergo a cycle of events. And in this cycle, the maximum pressure that is recorded is called systolic pressure, and it depends on the force of contraction of the ventricles, otherwise known as cardiac output. The main function of heart is to pump blood. So, the force of contraction determines the maximum pressure that is recorded, which is called systolic pressure. Another pressure that is recorded is called diastolic pressure, and it is the opposite. It is the minimum pressure that is recorded during a cardiac cycle. The normal systolic pressure is usually around 120 millimeters of mercury, and normal diastolic pressure is usually around 80 millimeters of mercury. The unit is always in millimeters of mercury because it is the level of elevation of mercury that we watch and record it. The difference between these two pressures, systolic and diastolic pressure, is called pulse pressure. So, normally the systolic pressure is 120 and the diastolic pressure is 80. The pulse pressure is 40. And it is the pulse pressure that determines the pulsatile nature of blood flow. Blood flow is pulsatile. It is forceful sometimes, it is less forceful sometimes. So, that is what we feel as pulse. So, this pulsatile nature of blood flow determines the pulse pressure, which is usually more in the case of adults, especially in elderly. In very old people, the pulse pressure is more, the difference is more. They have a high systolic pressure, physiologically normally, and low diastolic pressure. So, the difference is naturally more, pulse pressure is more in case of elderly. Now, I said systolic pressure is an indicator of force of contraction of the ventricles, how your heart pumps. Now, what does this diastolic pressure indicate? Diastolic pressure indicates the resistance against which the blood flows. The resistance offered by what? The blood vessel. This is called peripheral resistance. So, the resistance against which the blood flows determines the diastolic pressure. Systolic pressure usually has a lot of physiological variations. It varies with age, it varies with sex, it varies with build of individuals, it varies with the physical activity, it varies with the emotional status, it varies whether you have taken food and recording blood pressure, it decreases during sleep. So, there are a lot of physiological variations in systolic pressure. So, an elevated systolic pressure is not as significant. It is significant, but you should consider the physiological variations also, whereas diastolic pressure does not have such physiological variations. So, what I want to emphasize is in the first recording, if you see an elevated diastolic pressure, you should be more concerned than seeing a systolic pressure elevation, because systolic pressure can elevate when you see the doctor for the first time and you record BP. All of us must have experienced. You go to a clinic, the doctor with the white coat sits there with grim face and he stares at you, he ties the cuff, you he raises the mercury column. In your anxiety, you see the mercury level rising. As the mercury level rises and you keep watching it, your blood pressure also rises, which is called white coat hypertension, which is common and normal in most of the individuals. And just one recording of elevated systolic pressure, you should not brand him you are hypertensive and start prescribing medicines. So you should consider all these facts before concluding a person has got elevated blood pressure or not. So what I want to emphasize here is an elevated first time recorded diastolic pressure is much more significant than an elevated first time recorded systolic pressure. Then, as I said, the blood pressure weighs various physiological variations. So, before declaring a patient hypertensive, record the blood pressure in a proper way. How to properly record the blood pressure? Blood pressure is recorded properly once the patient comes to the clinic. The doctor should make him relaxed, make him sit in a chair with the arms on the sides without crossing like this. The legs also should not be crossed. You should preferably sit with the backrest. Then the pressure is recorded in the non-dominant arm. If he is a right-handed individual, record in the left hand with the cuff occupying at least 3/4 the size of the arm. Then talk to him, make him relax. Don't record immediately. At least 15 minutes after he sits down. Once he is at physical state of rest, mental state of rest, at least 2 to 3 hours after having his last food, once he calms down, relaxed, sitting with backrest, with the legs not crossed, arms not crossed, now you record. You make him at ease and then record. That is the best way to record blood pressure. The cuff size should be proper and the apparatus, the cuff and the heart should be at the same level. Apparatus should not be kept at higher level, he should not be seated low. So he should be seated at the same level, then record. This recording is called basal blood pressure. So an ideal blood pressure recorded in this way is called basal blood pressure. Then you take another reading 2 minutes after that. In both the readings show an elevated blood pressure. Then only you record or diagnose this case as a hypertension. Otherwise, don't be hurry to conclude that he is hypertensive. So make him relax, then take at least 2 readings. Both readings are elevated, then only he is declared a hypertension. Now, what is the value to declare a person hypertensive? As I said, in a normal 70 kg adult male who is between 20 to 30 years of age, everything is important. The normal blood pressure is 120 millimeters systolic and 80 millimeters diastolic. In such an individual, if the blood pressure elevates from 120, say 130, say 130 to 139 systolic is recorded and diastolic say 90 to 100 is recorded, he is declared pre-hypertensive. It's not hypertensive, it's pre-hypertensive. If the recording is above 140 millimeters of mercury systolic, the systolic pressure is recorded more than or equal to 140 to 149 millimeters of mercury, and diastolic pressure is recorded more than or equal to 100 to 110 millimeters of mercury, then he is declared hypertensive. If the recording is very high, say systolic pressure more than or equal to 180 millimeters of mercury and diastolic pressure more than or equal to 120 millimeters of mercury, then it is called very severe hypertension or malignant hypertension. It is an emergency. He has to be corrected immediately or else he is more prone for stroke or ischemia. So such values you should have that background. You consider the age of the patient, sex of the patient, build of the patient, his physical activity before declaring a person hypertensive. Now, what is the problem if he is hypertensive? Let there be an elevated blood pressure. Elevated blood pressure affects all the systems of the body. A persistent recording of even mild elevated blood pressure, say 130 to 90, 130 bar 90 millimeters of mercury in a 30-year-old, if he is recording it persistently over years, it can cause long-standing problems or problems affecting the blood vessels, mainly the heart, the kidney and the brain, which is called, they are prone for coronary heart disease, they are prone for stroke, they are prone for even end-stage renal disorder. So you should be very careful if a person continuously records an elevated blood pressure with respect to his age and sex over a long, immediately try to correct it and bring it back to normal. Now, is there any use for blood pressure? Normally, is there any use for blood pressure? A normal blood pressure is very, very essential for perfusion or blood flow to be maintained through all the tissues of the body. Number one. Number two, the normal blood pressure provides the filtration pressure at the level of glomerulus in the formation of glomerular filtrate, which is the first step in the formation of urine. To tell in simple words, for the formation of urine, blood pressure is required. For the nutrients and gases to reach, respiratory gases to reach all the cells and tissues of the body, the perfusion pressure or blood pressure is required. Also, blood pressure is required in the formation of a third space fluid called lymph, which is essential for various activities. So, for all these purposes, blood pressure is required. So, normally we require blood pressure. Only if it is elevated, it becomes problem. So, try to correct it, bring it back to normal as early as possible. And simple lifestyle measures such as maintaining ideal body weight, aerobic physical activity for at least 30 minutes a day for 5 days a week, a low salt intake, going to bed at proper time, sleeping for at least 7 hours a day. See to that in sleep, you should sleep more before 12 midnight. The sleep of 1 hour before midnight is equivalent to 2 to 3 hours of sleep after midnight. Have that in mind. So a good sleep is very, very essential. Only people who are sleep deprived, who are working at night, night shift workers are more prone for this elevated blood pressure. So a proper sleep, proper exercise, proper weight, low salt diet, low fat diet, all these are key in lifestyle modifications in keeping the blood pressure under control, because most common cause for blood pressure is it's called essential hypertension, where there is no specific primary cause. It is our lifestyle induced problems which can make the person hypertensive. Only 5% of individuals there is a known primary cause. That is, they will have some other disease, say a renal arterial stenosis. A problem in the blood vessel supply the kidney can cause hypertension, but it is rare. It is present only in less than 5% of cases. 95% of cases, hypertension is only essential hypertension, where there is no primary cause. Sometimes genetic factors can play a role. Say Asian Indians, hypertension is common because genetically they are more prone. Other than that, there is no primary cause for hypertension. Most of it is called essential hypertension. So, by simple lifestyle measures, by maintaining proper diet, proper exercise, having good sleep pattern, can prevent a person from becoming a hypertensive. Thank you.